Poornima Srinivas from Hills Dental Design, where beautiful and healthy smiles begin. Today I'm going to talk about in-chair tooth whitening. What is in-chair tooth whitening and what is the fuss all about? So the in-chair tooth whitening is where you are having whitening in the treatment rooms, and it is a 1 to 1.5 hour session, and you get that instant result. So there are two types of teeth whitening. Remember last time I went through home kit, so the home teeth whitening where you do it yourself, or you can do the in-chair teeth whitening where we do it for you. So what is the difference? So the difference is that we are putting a higher concentration of the hydrogen peroxide because we are doing it in a controlled environment. This higher concentration of hydrogen peroxide is what gives you that instant lift. So it will bleach the teeth and it lifts the stains up. Now, obviously, the stains are the coffee stains, the wine stains, all the food and drinks we eat over a period of time stains our teeth. The in-chair teeth whitening is also good if you have a grayish discoloration because that's a very hard one to bleach. And the in-chair teeth whitening, we can lift the stains as much as possible. So what is the downside to it? The downside is that, yes, of course, there's a cost involved because you're doing it in the treatment rooms. And also some people have sensitivity issues because of the concentration of hydrogen peroxide. So we have to balance it out. We give you products before, but if you have extremely sensitive teeth, then we do advise you not to go ahead with the in-chair whitening because you might end up having quite a bit of sensitive teeth, at least temporarily for a few days. But it's always good to know what you're getting into. Okay, so let's look at the procedure. So when you come in, we just do a prophy. So we just get rid of all the plaque on your teeth, and provided you've got healthy gums, of course. If you don't have healthy gums and it's bleeding and your gums are infected, obviously we're not going to do tooth whitening for you. Now I'm just going to use a model and show you what we do. So say this one here with the in-chair tooth whitening. All we need to do is to make sure the gums here are covered because the in-chair tooth whitening, the gums can burn if the product goes on the gums. Okay, so for that I just use a gingival barrier. So this is a little gingival barrier here which will be applied on the surfaces of the gums. So everywhere we're going to apply, so just your teeth are exposed. After we do that, we make sure the area is very dry. So there's a lot of cotton rolls. We just, make sure your teeth are actually retracted. And then we put the gel. So the gel, like this one here, we've got a tip and we just apply it on the teeth. And that sits on the teeth for 10 minutes. So when we do it for 10 minutes and then we take it off, so we suction it off and we reapply it. So it's done 3 times. Now, if the patient is okay, they don't have any sensitivity, we can push the time limit to 15 minutes per session. And then at the end of the treatment, we take out the retraction, the cotton rolls, the barrier and the gel, and we apply a tooth mousse just to calm the teeth because they're exposed to the strong the hydrogen peroxide. The patients are very happy because A, it's over and done with, B, they get instant results, and that's why they do have take home 3-inch tooth whitening. But a lot of the times why people get disappointed after paying the in-chair whitening is that they don't do any maintenance. So I always tell the patients, please make sure you have a maintenance program. It's like if you color your hair, you have to maintain it every, so often. So it might be 6 weeks or 8 weeks. Now, depending on the lifestyle, I make sure I give them a customized tray. And the take-home kit is given, not the full kit, just the maintenance kit is given so they can maintain it at home. And then the patients, then if they have a special event, I tell them to do it like a couple of days before for an hour, just bleach the teeth so they can maintain it, or just do a regular bleaching at home, either once a month, once every 2 months for an hour. Now that is dictated by your lifestyle and I leave that to the patient. So I don't want to say, well, just do this or follow this protocol because the maintenance is entirely, left to them, depends on their lifestyle. Now, after what I'm going to do next time, I think that's enough of in-chair tooth whitening. I'll just go through what to expect after tooth whitening. So the post-op instructions and how to take care of yourself and your teeth after in-chair tooth whitening. I hope you liked this post. Please like, share, or comment. We do a lot of tooth whitening at our practice. We are a cosmetically driven practice. So if you do want to talk about your options, please feel free to give us a call. This is Dr. Poornima Srinivas at Hills Dental Design, where healthy and beautiful smiles begin. Thank you for watching. Bye now.